Hello, I'm BJ Daniels, Assistant Dean of Assessment in the MD program, here to talk about entrustable professional activities. Have you ever had your preceptors confused about what their role is during an EPA encounter? Well, first, it's good to understand that there are two types of EPAs that the students need to get. The first involves direct observation, with the preceptor in the room with the student and the patient, observing the student talk to the patient, do a physical exam, or maybe do a procedure. The second form is indirect observation, which are discussions often without the patient present, such as the typical case review, or when you as a learner are interpreting an investigation as you discuss with your preceptor. When you log into assess.med, you will see 12 different EPAs. Some of these EPAs require direct observation with the preceptor in the room with you and the patient, and others indirect observation. Here are the EPAs that require direct observation: history and physical, handovers, urgent emergent patients, difficult communications, procedures, and educating patients on health promotion and preventive medicine. And then these EPAs require indirect observation, discuss your differential diagnosis, initial plan of investigation, or when you're presenting a case in oral or written format. And then the other EPAs have a bit of a combination, such as interpreting and communicating results of common tests. The interpretation can happen without the patient present, but the communication, of course, the preceptor's watching you talk to the patient. Same for management plans, and for safety and improvement, there's multiple subcomponents that can be a bit of both. I will admit, this is a work in progress, so we're going to work to modify the EPA forms to make this all clear to both learners and preceptors. Key points are, you as a learner identifies the EPA you want before the encounter, whether it's direct or indirect. The teacher then watches or discusses with you, thinking, is this learner independent at the end of clerkship? And then you and the teacher discuss feedback. And I would suggest you as a learner identify what you did well and what to work on, and the teacher can build on that. A pro tip is, you as a learner, just fill everything in on your mobile device. Make sure your preceptor is okay with that. Then show them what you documented, and then ask them if you can just hit submit. This will avoid EPAs ending up in the save for later void. We got a lot of EPAs in the email inbox void, and we can avoid that by just hitting submit. If you have any questions or concerns, feel free to email me at vdaniels@ualberta.ca. And lastly, thank you for your patience as we roll out EPAs in the MD program.